Our guest first appeared on this podcast back in 2021 and returns to share more of her journey on this episode. She is a visionary executive leader who has spent more than 25 years serving families, children, the aging population, and people experiencing homelessness. You're listening to the PHEC podcast, episode 412. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations, community health foundations, and government agencies. We specialize in a variety of community assessments, helping our clients collect, analyze, manage, and communicate their health information in plain language to the communities they serve. The type of support that we provide often falls in the category of strategic planning and sometimes capacity building. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links are going to be provided in the show notes as well as the description for this episode. I'm excited to introduce you to my guest on this episode. She was our guest back in episode 201. That was June of 2021. So fast forward, so much has changed and has happened, and she's updating us and filling in the gaps. And I'm excited for you to hear that. Now, I've been in touch with her across the years, so it's not all brand new to me, but I love being able to bring back past guests on the podcast and for them to share their journey, especially when several years have passed. There's so much that happens in all of our careers and walks. So it's really nice when we have a chance to bring someone back. Actually, I also looked this up when I was preparing because when we had our interview, I couldn't remember exactly when she had been on the podcast. But when I looked it up, I was surprised to see just how much time had passed by. And it was right before we actually changed the name of our podcast. So if you do go back and listen to that episode with her, the previous one, and we will provide links in the show notes. But if you go back and listen, the music will be different and you'll hear me reference the name of the podcast a little differently. So back then, the podcast started out as Public Health Epidemiology Careers Podcast. And right around episode 209 or 210, we changed the name to Public Health Epidemiology Conversations Podcast. We changed the music and everything. So if you go back and hear this one, which I still encourage you to do because it was so career focused, she shared a lot of insights and tips for students and early career professionals. So it's a great episode to go back and listen to. Plus, it's really nice to hear where she was then compared to what she shares now. So we'll provide those links in the show notes for you as well. But let me formally introduce her to you, and then I'll connect our conversation. Commissioner Dannette R. Smith is a visionary executive leader who has spent more than 25 years serving families, children, the aging population, and people experiencing homelessness. She's led human services departments across the country, utilizing data-driven outcomes and engagement strategies, fostering staff development and community involvement, all with the goal of developing and maintaining innovative, stable, and effective programs. Most recently, Commissioner Smith served nearly 5 years as the Chief Executive Officer at the Nebraska Department of Health and Human Services, where she supported 5 divisions: behavioral health, children and family services, developmental disabilities, Medicaid and long-term care, and public health. During her tenure in Nebraska, she convened a statewide behavioral health task force focused on opportunities to improve behavioral health services for adults and children, as well as initiated the exploration of Medicaid utilization as a payer for behavioral health services, and redesigned the youth rehabilitation and treatment center systems to include intensive clinical and therapeutic services in the juvenile justice system. While in Virginia Beach, she collaborated with the Sheriff's Department to provide enhanced behavioral health services in the jail system and provided strategic oversight in the development of the First Responders Initiative to provide behavioral health services in the community with the Virginia Beach Police Department as part of their service calls. In all of her roles, she works to build and sustain partnerships and positive relationships to best serve the community. You will hear this in our conversation today on this episode, and you'll also hear it if you go back and listen to the previous episode with her a few years ago as well. It's really clear, and you can hear that passion in her voice as she speaks. The 2023 recipient of the Lifetime Achievement Award for the American Public Human Services Association, Commissioner Smith holds a Bachelor of Science in Psychology from Eastern Michigan University and a master's degree in social work from the University of Illinois, Chicago. She also completed the Kennedy School of Government Child Welfare Executive Leadership Program at Harvard. Let's connect my conversation with Commissioner Smith right now. Well, I'm excited to have a conversation with my dear friend, Dannette Smith. How are you doing? Welcome back to the podcast.
Charlotte, I am doing well, and thank you for having me back.
Oh, I'm excited. I love doing this. We started a couple years ago bringing back certain guests after some time had passed and just kind of catching up with what's happened. And it's turned into such a big reunion meeting. It's also kind of exciting to see how people have pivoted and changed. I know you've had some big changes. So I am looking forward to it. Like I said, before we hit record, I said this is going to be the two of us genuinely catching up on what's going on with each other, and everybody else just gets to tune in and listen. So let's start with officially an introduction. So some people may not be familiar with you or may have heard our previous podcast, but just introduce yourself. Tell us a little about you and what you do.
Well, Charlotte, first, let me just start by saying I am so humbled that you asked me to come back. I feel like it's more than maybe 2 years that have gone by that we talked. In fact, it feels like a little longer because when we first met each other, we were talking during the pandemic. And I think as we were doing the interview, I remember my chief of staff in the background saying, this is going on. Governor wants a response on this. We just had a lot going on at the time. And as you might remember, about 2.5 years ago, I think it's been that long, I was the state secretary, or what they call in the state of Nebraska, the CEO of Health and Human Services. I was there for about 4 years and certainly enjoyed the experience there and learned a lot about what it means to be a leader during a COVID period of time. Because, as I reflect on that time, there is nothing that really prepares you for that. You just got to step into that space and lead from that space. And so that's kind of what happened with me. And there were certain other kind of crises that were going on in Nebraska, but the big one was certainly the pandemic and working with my staff on the public health side.
Oh, yes. I remember that too. So much was changing so quickly.
Right.
And it's kind of a similar situation right now, but I won't fast forward too much, too fast. By the time this episode airs, I will have done some homework to find out what that date was, because I like to kind of pinpoint when we talked before. But definitely a lot's happened since then. So where are you now?
Yes, so I ended up transitioning to the state of Colorado, where I am the Behavioral Health Administration Commissioner. This is a brand new department to the state of Colorado that is purely focusing on behavioral health in the community. We are using a community-based lens for how we want to be able to provide behavioral health services. This organization was launched about 3 years ago. There was a task force that was put together by Jared Polis, who is our governor, really with the eye to how do we better support people who have mental health issues or behavioral health issues? What does the support look like? How do we get the support to be more community-based, where people really have access to good services throughout the state of Colorado? So what we decided to do, Charlotte, was to develop 4 quadrants of what we're calling the BASO model, which is going to be renamed by the time you air this, Colorado Lifts. And it's really about lifting Coloradans who may experience behavioral health challenges and needs and being able to access them in the right services the right way. When the governor developed this particular state agency, he created a task force that kind of gave vision. There are 6 pillars that went along with that vision, as well as 19 accountabilities or at least areas of focus that he wanted to see. With the creation of that task force, the task force then gave the governor recommendations from those 6 pillars in terms of access, workforce, accountability, affordability. Those were some of the pillars that the task force came up with. This organization started back in 2022. I think I'm dating myself correctly. I've been here a year, and we've had a variety of different leaderships in the space, but I've been here for about 13 months, and I'll tell you, I'm really enjoying the work. It's an opportunity to be innovative, creative. It continues, and this is very dear to me. It allows me my ability to continue to serve people in the community for which I live, and that's very, very important to me. I don't want to just lead an organization. I want to be able to serve the population that I'm serving. So I'm very excited about where we're going. We're going to be launching what we're now calling the Behavioral Health Administrative Service Organization, or will be renamed Colorado Lift. We'll be doing that formal launching July 9th. But prior to that, we have kind of what we're calling BHA, or Behavioral Health Administration 2025 Summit. And it's everything you wanted to know about behavioral health, but probably was scared to ask. We're going to talk a little bit about where we've been from the task force to where we are right now, and what does the future of behavioral health look like. And I want to be honest with you, Charlotte, all of this is transformational work. All of this will take time and years to build the right system. But what we're trying to do is to launch a framework that will then support Coloradans in being able to actually access behavioral health for adults and for children, with the eye to looking at the specific needs that children and adults have separately.
Wow, that sounds incredible. It sounds like a total revamp.
It is a total revamp.
So what initiated a big change like this?
Well, I think when the governor got in office his first term, he was hearing from the community that behavioral health services for children, for adults, just was not accessible. And when they were accessible, you had to be in the child welfare system or juvenile justice for children. When available for adults, you had to be in the jail system or in the hospital system. And quite frankly, Charlotte, what we're trying to do here at BHA is be more proactive, looking at preventive strategies, where there's opportunities to do an integrated model. And we're not there yet, where we would do one medical, physical health, and psychiatric care so that we meet both the needs. And then once you've received those services, how do we provide maintenance support so that you don't have to come back in the system? And that's where the community is so important. And so because the governor was hearing concerns from other Coloradans about the lack of behavioral health services, this is what inspired him to develop the task force, who then made recommendations to a state organization, and it was the impetus to the Behavioral Health Administration. And so I'm happy to be here, being part of its growth, perhaps probably developing its foundation, not only from an organizational standpoint, but really from a service delivery standpoint. What will it take for us to look at serving children and adults in a different way? One of the charges of the Behavioral Health Administration is really to serve people who are uninsured and underinsured. We work very closely with Medicaid, and we want to make sure that we are the stopgap to providing those services for people who are in need. The second thing that we want to do is to be able to develop good programming that our Colorado Lift partners are going to be exploring out in their 4 regions of the state, the quadrant of the state, but also making sure that we have good behavioral health policy. And finally, that we act as the authority to setting good regulations and policy for people who serve persons with behavioral health. So we're responsible for legislation and for rule development and regulation here under the department. We're a small but mighty department, Charlotte. There's only 150 of us. But you know how I think about that. We could be lean and mean.
That's right.
That's what we're aspiring to do.
That is inspiring to hear you. I love the energy. It takes a lot of courage, really, to make a lot of big changes like that at one time. And I know it's not an overnight fix, but, that's a lot to implement and very admirable. There's a lot of public health sprinkling all around this with the the desire to get in front of this and to be more proactive and preventive. Love it. So how have you adjusted to the transition? Was it you just dropped in and hit the ground running, or did you have some time to adjust from Nebraska to Colorado? Did it phase you at all?
I would tell you that for the first time in my career, I took about 7 to 8 months off. And to be honest with you, Charlotte, I did a lot of self-reflection in terms of whether or not, let me just say this, whether or not there was a next step for me. I have enjoyed the public health space and, quite frankly, the human services space all of my career. I've had a wonderful, wonderful career where I have met many, many people who have worked for me, but also many, many people that I've served, and I have treasured those relationships and the ability to do that work. So I took 7 to 8 months off and went to Spain and took a cruise. And I was on a cruise for about 11 days. It was probably the best cruise between Barcelona and Portugal. And it just gave me an opportunity to reflect on what's next for Dannette and where does Dannette want to spend the closure of her career, and how should that career end in a way that speaks to a very bold woman, a very courageous woman, somebody who is very insightful about herself, someone who is an innovator, transformer. How does that all come together in a way that we begin to start talking about she's at the end of the career and it's really time for somebody else to take up the mantle? And so not quite there yet, but I sure am reflecting on what that's going to look like for myself. And we'll see. It's kind of a wait and see kind of game that I'm playing with myself.
I love every bit of that because, well, first of all, the pause and reflection, that's something we need to do on a more consistent, regular basis, really. But I think the time to pause and reflect over what we've come through, where are we, what have we accomplished, what's next, what's rising up, and what are we feeling? I do remember, I think that was I remember talking to you when you were getting ready for that cruise, because I was quite jealous. I was like, I'd like to go, I need to take a break. My vacations are not, they're good, but I need, and fun fact, actually, that did inspire me quite a bit because I have a rather significant vacation coming up that I'm excited about. But I really remember talking to you as you were planning for that. And I say jealous, but all in the right ways, but just listening to you as you were having that very intentional reflection period, and you were just doing everything that I think is very admirable, and we should take notes on, just that ability to sometimes pausing does mean removing yourself from everything that's familiar and normal, getting really away so that you don't have your normal distractions and you can focus on whatever it is you're intending to focus on, yourself, your reflection, your everything there. So I love all of that. And it sounds like on the other side of that, then being matched with this opportunity, like you were actually so ready. You did that really strong transition in the middle that was focused on you. And then you were ready to then serve in Colorado and take on this challenge. So I like that so much.
Yeah, so I would tell you that when I went on the cruise, it was all about me. And from a couple of perspectives. One, gratefulness. I am so grateful to have good family who kind of sometimes, quite frankly, put up with me. I'm very grateful. I am grateful to the people who have worked for me and the people who are working for me now. I am very grateful. I am a very disciplined woman, and what comes along with discipline sometimes is the need to have things done in a particular way. I am grateful that people kind of put up with that. And although it hasn't failed me in my career, I recognize that everybody can't do that. So when I took the trip, I was in gratefulness. I was also in a space of how do I choose to live my life moving forward? And so I made some conscious decisions of how I was not going to live my life. Some I kind of reverted back to, and some I haven't. Number one is Dannette is important, and she's important to her family, and she's important to the world. And so she needs to do things that suggest that she's living a better life. I would work, done a little bit of it here, but I would work in Nebraska, like can't see in the morning till you can't see at night. I do that here, but that's more occasionally than all the time. I have decided that my weekends are for me. And if I need to do something for work, I'll get up early in the morning and get it done. But the weekends are for me to be able to rejuvenate. So I don't do anything on the weekends. It's really just my time. The second thing is really acknowledging my girls and my goddaughters. I have about four of those. I have two daughters that are mine, and I have two goddaughters. How do I spend my time with them? And my godchild. How do I show up in Charlotte? How do I show up on the job? It was all about reflecting about who I am and how I want to finish out. And so I took that time on the cruise to do just that. I did some reading of some books, things that I really like to do that I haven't been able to do because I've been reading reports about COVID stats and everything, or child welfare, or something about behavioral health. But I really took that time to really reflect. And then finally, what I would say to you is I have some really great friends. I have some really good women friends as well as male friends who surround me and continually remind me of who I am. And I think anytime that you take these jobs, to not have a group of people who knew you in and who can remind you of that and also can see your path forward. When you can't see your path forward, it's just so important. So that's why you hear me talk about being so grateful, because without gratitude, I don't think that you can fully experience what God and the universe has for you if you're not grateful for the little things. And so I'm grateful for the little things.
Oh, that's so wonderful. I agree with you. There's a lot of power in gratitude. And thank you for giving us a little masterclass on that, because a lot of people, I think, in our audience need to hear that and need to be reminded. But that's really important. That's so refreshing, especially in today's time. I think we need to practice that more. And sometimes it's hard to remember that of the things that, or we have to set an intention and really a purpose and a time and start and lead with the gratitude as opposed to the chaos and the other things that surface.
And be able to set great intention. So often I hear people say, well, I'm not going to declare this. Well, I think sometimes we have to know when to declare things, when to be intentional about those things that help us grow. Those things that help us grow aren't the things that feel good. Quite frankly, they're the ones that are the most painful. And I can go back in my career, my personal life, and give some really good examples of things that just didn't go well. That's not what I expected it to be, but it just didn't go well. So I think we have to be intentional in how we set our go forward plan in life. I certainly tried to do that on the cruise. And when I came back from the cruise, I was like a different person. I looked different. I felt different. And so again, I just can't speak to how important gratitude is and setting your intention, quite frankly, and trying to live within that intention.
I practice every year, I have a word of the year. So a few years ago, my word of the year was intentional. And it's not like, oh, there's just that year I thought about it and I didn't. It's always, it's a practice and a super focus for the year. And then it's integrated into still what I do every year since then.
Last year, my word of the year was abundance, and not so much about money. It was about the little things that could come my way that would make my life different. That's number one. But number two, how do I create abundance for others? Because if I create abundance for others, I get it back. So last year, it was in all of my passwords, your bank, your this, your that, abundance. Abundance was my word of the year.
I love that. I love that. Well, I'm going to ask for, because this is a great time and you're a wonderful person to kind of reflect on this. Since we're recording this in May of 2025, just to put into context, because people listen to these episodes at different times. So since the beginning of this year, we have been experiencing just one after the other with reduction in programs and services, just a lot of changes since the transition of this new political administration. And a lot of it feels like a personal attack on public health. I've heard so many different views, and we don't need to go down a rabbit trail of that. But there has been so many dramatic changes, very quick, rapid changes to organization systems, and the effects trickle down into every organization, and it shows up differently. So my question for you is, in Colorado, in your organization, your department, are there any challenges that you all have faced that have risen up in this time? And if so, how are you addressing those?
So, yeah, Charlotte, we have had multiple crises here, but I would tell you loss of funding, very concerned about how it impacts our provider network, but not only our provider network, how it affects them being able to serve. Remember, I said I came here to serve. And so I am very concerned about what the loss of funding is going to mean for us. But here's what I would say to you, because I've been around a long time. I remain hopeful. I still remain hopeful that we're going to have to figure out, like we've never figured out before, how to get people served in a different way. I think it is going to mean the funding that we have, we're going to have to use it differently. I think the relationships that we've had, those relationships are going to have to be utilized in a different way. And Charlotte, the other thing I would tell you, my third point, is we're going to have to bring some people who never were in the behavioral health human services field to the table to help us serve. People we never thought of who are going to have to come to the table to help us be able to serve people here in Colorado, which means we're going to have to be vulnerable and say we don't have the answer. You know, government doesn't like to do that, but we're going to have to say that we don't have the answer. We're looking for the answer outside of us. That's where the hope comes in, is that I'm really going to have to go to somebody that I would not normally have to go to and say, I'm going to need your help if I'm going to serve Coloradans in the behavioral health space. And then finally, that funding that we get is going to have to be used in a different way, because what the message we're clearly getting is that you have, you may not have, and if you do, it may come with strings. And so that takes me into the question about, are we here to serve the collective, or are we here to serve an agenda? I believe that we're here to serve the collective. And that has been how I have viewed all of these changes, that if I serve the collective, then people get served and they get what they need. But I'm going to have to think way outside the box like I never had before. And I'm going to have to invite some people in. I'm going to have to be vulnerable with my leadership to be able to get the kind of support that I need. They don't teach that to you in social work school, public health. They don't teach you that. You kind of got to learn that on the job. But that's where we are. And I think if we look at this from a sphere of hopefulness instead of hopelessness, that gives you more energy to do what you need to do. If I look at it from hopelessness, that's going to impact my ability to serve people. And I don't want my hopelessness to impact with the people I serve. So I'm still in hopefulness, still hoping. Some people say that might be Pollyanna, and it may be Pollyannish. I don't know. But what else do we have right now? We have to figure out the balance between fighting and serving. I tend to want to serve the collective, not that I'm not willing to fight, but I want to choose that battle so that I'm able to serve.
That is really powerful. There's a lot of good quotes to pull out of what you just said. And I lean in carefully because you're someone that, I admire my guests on this podcast. I especially needed to hear from you with all the experience that you carry, and you're so wise on so many different levels, but just hearing what you are describing, it makes so much sense. For the record, last year, my word of the year was vulnerability, or being vulnerable is a choice, and it yields you closer relationships. But when you're willing to take off your nice press coat, roll up your sleeve, show your scar, show your imperfections, and ask for assistance and be willing to hear, that takes a lot of energy, but the rewards are great on the other end. So to hear you use that, like I've experienced that personally across the year. So to hear you use that and describe like government systems are going to have to take that position. And you're right. It's not, I used to work for state government here for a while, for about 6 or 7 years. I know that that is not an easy thing to do with strong systems. But if they're willing to, then there is such opportunity for a greater way to serve on the other end. And I think in a time like this, it's not going to be a one person or one organization that's going to suddenly figure it out and solve it for all of us. It's going to be organizations that are willing to come together on the same thing that you're describing and saying, okay, maybe even locking arms in some situations and saying, we don't know the answers. Let's bring someone, like you said, some of these different people to the table. And I think some of these different people are waiting, excited to come to the table.
Correct. I was in another venue 2 weeks ago where I challenged some of my colleagues to think beyond what we wrote up on the board, which was the standard human service vernacular about SNAP, about TANF, about child welfare. And I challenged them to what would this room and this work look like if we asked Walmart to the table, if we asked the YMCA to the table. They're very conservative. What would it look like to ask some of those folks to this table? And I think, Charlotte, what you hear me saying is leadership is about being vulnerable. Nobody follows a leader that plays it safe. I've certainly seen that in my career. In fact, I've had some of my staff pull me by the neck and say, you're going too far out there. But nobody follows a leader who plays it safe. They want somebody who will challenge them to be the very best. And so the person who's leading has got to be willing to be the very best. And the only way you get to being the very best is being vulnerable. And so you got to be willing to do that. I certainly, the people who have been the most memorable in my career have not been the people I've reported to who made it comfortable for me. It was the persons that said, no, I think you can do it. Get out there and try it. And I'm behind you. I want you to try it because look at me. I'm trying it. And I think that's where we are. And that's why I go back to using that word of collective. This is all about the collective to serve, but the collective to be in a position so that people who benefit from our services can really benefit. You have to have a collective mind to work with other people who are not like you, and you got to have a collective mind to be able to serve the collective. It appears to me that some of that collective thinking is withering away. I think it's up to some of us who still believe in it to bring it back alive, because that's really what we're into. Public health is all about serving the collective and starting, hopefully, with a preventative lens in being able to do that. Here in Colorado, we work very closely with public health around maternal child health, particularly as it has to do with mothers who are having challenges with behavioral health issues. We work alongside with our early childhood department around early childhood mental health and what they need to see in early childhood programs. We even work in the agriculture field. As you may know, Colorado has a very agricultural state. And because of that, we work very closely with ag because there have been in this state a tendency to suicide when things don't go right in some of our industry, our ag industries. So we're trying to bring behavioral health for the collective alive and thinking through what that work looks like in a very, very different way than probably we have in the past. I think what's so different now is that the changes have been abrupt. They've been fast. And we can't get behind the thinking. And I think whenever you can't get behind the thinking, you pause to make sure that you understand before you proceed. And you may never understand, but you proceed thinking that you're going to probably be taking a risk. It's probably a risk that's necessary, but it's all about serving the collective. And sometimes I feel like we've gotten away from that because that's what we get. That's certainly what I got into this field.
Well, you have definitely helped me and really, I think that I am of the few that are still really wanting to serve and really thinking outside the box and really I'm searching for the collective. I'm looking for that arm to lock with. And it feels very lonely because I'm going in one direction, everyone else is going in the other direction. Not bashing them, but I just feel very different about it. So this conversation helps me to feel more like, okay, well, I am doing the right thing. I'm going in the right direction. There are a few of us out here.
Pause doesn't mean that you're not moving forward. Pause to me is taking a look at the landscape and seeing where you can have the most impact. That's what pause means for me. This isn't the first time that we've had this kind of monumental change. This is just the first time that somebody dared to pull the lever. That's what's to end with the expediency to it without any planning and any warning.
That's the part. Yeah.
But but this isn't the first time. This is not time. So I don't, to say all of that, I don't see a pause as not a step forward. I think a pause is then being strategic about what the step forward is. That's how I see it. And that's how I've chosen to do it here in Colorado. I mean, people have asked me, how are you staying afloat? Because I'm still hopeful. And I'm in the swirl of being in a pause, and I'm looking for the next strategy to be able to implement before I move forward. Because in this case, I don't have a whole lot of money. And I've got to figure out that strategy in a very creative way. And so a pause doesn't mean I'm retreating. The pause is I'm trying to figure out where I'm going to put the next chess piece, because that chess piece has got to be able to galvanize how we serve people, and in a different way.
That's strong. Thank you. Oh my goodness, we could talk on for this, but I want to be mindful of time because we're already kind of at the goal time. But this has been just a wonderful conversation. I enjoy catching up with you. I just admire so much of what you're doing and always have. And I'm excited to follow this project, the work that you're doing in Colorado, and to see how far you go before you decide that this is the time where you're going to pivot. I don't know what your plans are, how long into the future you're going to be working, because you've alluded to kind of, wrapping things up on my career part. But I'm looking forward to seeing how far you go with the project and the changes that you're a part of there in Colorado, and being that inspiration so others will be able to model after what's happening in Colorado, implement into their state. I appreciate your words of encouragement in this, what we call it, wherever place we are in this journey right now. But, you've given us a lot to reflect on, or the idea of reflection and the focus on gratitude and the pause. Even I talked about that initially, needing to pause and regroup. And some people are still trying to kind of see where they're going to make their next strategic move. Others are starting to make moves. It's helpful to hear all of that. I really appreciated that. So thank you for making time for us.
Yeah, just like people think pause isn't a move forward, no isn't a move forward either. See, I see when my executive has told me no, I see it as a time to regroup and come back. And it's really funny because when I was in Nebraska, I would get no quite a bit. And, it was funny because the governor would say, she's coming back in 2 weeks. Absolutely. Because my ability to serve people was more important than the no to shut me down. And so I just kept coming back. And so that I equate the no and the pause in the same lane. None of it means stop. It means an opportunity to move, but to move differently. And I think that's the environment that we're in right now, even though it is painful for all of us. People have lost jobs, and I don't minimize that. That is critical. Programs across the country have lost funding. I don't minimize that. That's serious. But now that we're in this environment of uncertainty, before we put the next chess piece down, let's take a good look at the lay of the land.
Yeah, that's good. Well, like I said, thank you so much. This is a fantastic way to wrap up the conversation, but I look forward to keeping in touch with you as always.
Look forward to it as well.
All right, Dannette, we'll talk again soon.
We will. Thank you.
I really hope you enjoyed that conversation as much as we did. I encourage you to connect with Commissioner Smith and learn more about the work that she's doing now in Colorado. Be sure to let her know that you heard her on this podcast. You can find the link to connect with her on the show notes page. The show notes page for this episode, which is episode 412, can be found at phecpodcast.com. Once you're there, just navigate to episode 412 to find its show notes. One more thing before you go. Remember that our podcast has a new app where we can continue the conversations from episodes like this one with public health professionals from around the world. You can download our new PHEC Podcast Community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.